DID, formerly known as multiple personality disorder, is a complex psychological condition characterized by the presence of two or more distinct personality states or identities within an individual. These identities may have their own distinct names, characteristics, memories, and ways of interacting with the world. Symptoms: presence of two or more distinct identities or personality states, each with its own enduring pattern of perceiving, relating to, and thinking about the environment and self. Gaps in memory about everyday events, personal information, or traumatic experiences that are inconsistent with ordinary forgetting. Significant distress or impairment in social, occupational, or other important areas of functioning due to the disorder. Causes: typically develops as a coping mechanism in response to severe trauma during childhood, often as a means of dissociating from overwhelming experiences. Trauma can include physical, sexual, or emotional abuse, neglect, or other forms of trauma during critical developmental stages. Diagnosis: diagnosis is complex and often requires thorough assessment by mental health professionals. Criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, are used for diagnosis. Differential diagnosis is crucial to rule out other conditions with similar symptoms, such as schizophrenia or borderline personality disorder. Treatment: treatment typically involves psychotherapy, particularly approaches like dialectical behavior therapy, DBT, cognitive behavioral therapy, CBT, or eye movement desensitization and reprocessing, EMDR. Goal of therapy is to integrate the distinct identities and address underlying trauma. Medication may be prescribed to manage symptoms like depression, anxiety, or mood instability. Controversy and misunderstanding: DID has faced skepticism and controversy within the psychiatric community and broader society. Media portrayals often sensationalize and misrepresent the disorder, leading to misunderstandings and stigma. Some professionals question the validity of DID as a distinct diagnosis, while others emphasize the importance of recognizing and addressing the underlying trauma. Prognosis: prognosis varies widely depending on factors such as the severity of trauma, availability of supportive resources, and commitment to therapy. With appropriate treatment and support, many individuals with DID can achieve improved functioning and integration of identities. Long-term therapy and ongoing support may be necessary to manage symptoms and prevent relapse. Integration and company consciousness: integration refers to the process by which the distinct identities within an individual with DID merge into a single, cohesive identity. Co-consciousness, on the other hand, involves the different identities within the individual being aware of each other and able to communicate internally. Both integration and co-consciousness are considered therapeutic goals in the treatment of DID, facilitating improved functioning and decreased distress. Challenges in treatment: treatment of DID can be challenging due to the complexity of the disorder and the often extensive trauma histories of individuals with the condition. Therapists must establish trust and safety with clients before addressing traumatic material, which can take time and patience. Additionally, coordination of care among mental health professionals, medical providers, and support systems may be necessary to address the diverse needs of individuals with DID. Impact on daily life: DID can significantly impact various aspects of daily life, including relationships, work or school performance, and self-care. Individuals with DID may experience difficulties maintaining stable relationships due to the presence of different identities with varying traits and preferences. Work or school functioning may be disrupted by memory gaps, dissociative episodes, or symptoms of depression and anxiety. Self-care may also be compromised by dissociative symptoms, as individuals may struggle to remember important tasks or events. Support and advocacy: support groups and advocacy organizations play a crucial role in raising awareness, providing resources, and reducing stigma surrounding DID. Peer support from others who have experienced similar challenges can be invaluable for individuals with DID and their loved ones. Advocacy efforts aim to promote accurate understanding of the disorder, increase access to quality mental health care, and challenge discrimination against individuals with DID. Continued research and understanding: research on DID continues to evolve, with ongoing efforts to better understand its etiology, neurobiology, and effective treatment approaches. Advances in neuroimaging techniques and trauma research contribute to a deeper understanding of the underlying mechanisms of DID. Continued collaboration among researchers, clinicians, and individuals with lived experience of DID is essential for advancing knowledge and improving outcomes for those affected by the disorder.